As we get older, our bodies change, and that means our diet should change too. You've probably heard that fruits are always healthy, but for seniors, that's not always true. In fact, some fruits can actually cause more harm than good, leading to blood sugar spikes, digestive problems, and even serious medication interactions. In today's video, we're diving into the 5 dangerous fruits seniors should never eat. Stick around to the end, because number 5 is one most people eat every single morning without thinking twice. Grapefruit, how it dangerously interferes with medications. Grapefruit may look innocent, but for seniors taking certain medications, this citrus fruit can be downright dangerous. That's because grapefruit contains natural compounds called furanomerins, which interfere with an enzyme in your intestines known as CYP3A4. This enzyme helps break down many common prescription drugs, like statins for cholesterol, calcium channel blockers for blood pressure, and some anxiety or sleep medications. When grapefruit blocks this enzyme, the medications can build up to dangerously high levels in your bloodstream. That means what's normally a safe dose becomes too strong, leading to side effects like muscle damage, dangerously low blood pressure, dizziness, irregular heartbeat, and even kidney problems. What's even more troubling is that this effect can happen with just 1 glass of grapefruit juice or half a fruit, and it can linger in the body for up to 72 hours. That means even spacing out your medications and fruit won't always help. Many seniors are not warned about this interaction and continue eating grapefruit believing it's heart-healthy, when in reality, it might be sabotaging their treatment. According to the FDA and Mayo Clinic, over 85 medications can be affected by grapefruit, and the list keeps growing. Even some over-the-counter medications and supplements may be impacted. If you've ever had grapefruit as part of a healthy breakfast along with your morning pills, you might unknowingly be risking serious side effects. Some doctors even refer to grapefruit as a silent saboteur for older patients on regular medications. It's especially risky for people on drugs like atorvastatin, simvastatin, amlodipine, or buspirone. A 2012 study published in the Canadian Medical Association Journal found that drug interactions with grapefruit led to serious adverse effects in more than 6% of hospital admissions for seniors on heart medication. That's a startling number when you consider how often this fruit is marketed as a good source of vitamin C and fiber. But vitamin C can be found in plenty of safer fruits, like kiwi, strawberries, and papaya, without the dangerous side effects. The key takeaway here is this: if you're over 60 and on any long-term medication, skip the grapefruit. Talk to your pharmacist or doctor to review your medications and confirm if this fruit is on your personal do not eat list. It's better to be safe than sorry. Grapefruit might have benefits for younger, healthy people, but for seniors managing chronic conditions, it's just not worth the risk. Always read your medication warnings, and remember, what's healthy for one person might be harmful for another. When it comes to grapefruit and your health, the smartest choice is simply to avoid it entirely. Watermelon, the hidden blood sugar trap for seniors. Watermelon is often seen as the perfect summer fruit. It's sweet, juicy, hydrating, and seems like a guilt-free treat. But for seniors, especially those managing diabetes, prediabetes, or blood sugar concerns, watermelon can actually be a hidden danger. What many people don't realize is that watermelon has one of the highest glycemic indexes of any fruit. This means it can cause a rapid spike in blood sugar shortly after eating it. While its glycemic load per serving is moderate, the trouble starts when people eat large portions, which is very common with watermelon. It's easy to eat a big bowl without realizing just how much sugar you're taking in. A standard 2-cup serving of diced watermelon contains about 22 grams of natural sugar. That's more than what you'd get in a small donut. But because it's natural sugar, many assume it's harmless. For older adults with slower metabolism, reduced insulin sensitivity, or taking medication for glucose control, this can be a major problem. Spikes in blood sugar aren't just uncomfortable, they're dangerous over time. They can cause fatigue, blurred vision, headaches, and lead to long-term complications like nerve damage, kidney strain, or worsening heart disease. According to the American Diabetes Association, managing blood sugar is one of the most critical factors in healthy aging, and certain high-sugar fruits like watermelon can quietly sabotage that effort. Another issue is that watermelon is mostly water and sugar, offering very little fiber or fat to slow down digestion. That means the sugar hits your bloodstream fast, with no buffer. Unlike apples or pears, which have fiber that helps control the sugar release, watermelon enters the bloodstream almost immediately. This is why people often feel a sugar crash after eating it, followed by more hunger or even dizziness. Seniors may also be more sensitive to hydration changes. While watermelon is hydrating, it acts as a diuretic, increasing the need to urinate. This can be problematic for older adults with bladder issues or those already on diuretics for blood pressure. It can throw off electrolyte balance, making them feel lightheaded or dizzy. There's also the risk of portion size confusion. A single slice of watermelon might look modest, but depending on the size, it could contain over 30 grams of sugar. That's more than the recommended amount of added sugar for an entire day. Seniors often eat fruit thinking it's a better dessert, and in many cases, that's true. But watermelon isn't just a dessert, it's a sugar bomb in disguise. A study published in the Journal of Nutrition and Aging highlighted how high glycemic fruits like watermelon are associated with increased insulin resistance in older populations, even when calorie counts were kept low. This proves that it's not just about how many calories you eat, but what kind of sugar you're consuming. Watermelon may not need to be completely eliminated for everyone, but it should absolutely be treated as a rare treat, not a daily snack. For seniors, moderation is key. And in most cases, it's safer to skip it altogether and choose fruits like berries, apples, or even citrus fruits like oranges or mandarins, which have a lower glycemic impact and provide more fiber per bite. If you're managing blood sugar, always pair fruit with a source of healthy fat or protein to help slow absorption. But even with that tip, watermelon still ranks as one of the worst offenders for blood sugar spikes. The bright red flesh might look refreshing, but for seniors watching their blood glucose, it's a fruit that deserves a second thought. Sometimes the healthiest choices are the ones we don't expect. And in this case, the summer favorite might be doing more harm than good. Dried fruits, a sneaky source of sugar and digestive distress. Dried fruits may seem like a healthy snack option, but for seniors, they can be surprisingly harmful. Many older adults choose dried fruits like raisins, dates, apricots, and prunes because they're convenient and don't spoil quickly. But behind that sweet taste hides a concentrated source of sugar, calories, and in many cases, added preservatives that can cause trouble for aging bodies. When fruit is dried, all the water is removed, but the sugar remains. This means that even a small handful of dried fruit can contain as much sugar as a whole can of soda. For example, a quarter cup of raisins contains over 25 grams of sugar. That's more than 5 teaspoons. Seniors who snack on dried fruit throughout the day may think they're making a smart choice, but they're actually flooding their system with sugar, leading to spikes in blood glucose levels. This is especially dangerous for those with type 2 diabetes, prediabetes, or those trying to maintain stable energy levels. Sugar spikes followed by crashes can leave older adults feeling tired, irritable, or dizzy, and over time, this pattern can contribute to insulin resistance and weight gain. Dried fruits are also very high in calories, and because they're small and chewy, it's easy to overeat them. You might eat 10 or 15 dried apricots in a sitting without realizing that's the same as eating 4 or 5 fresh apricots at once. This creates a calorie imbalance that can lead to unwanted weight gain, which is linked to higher risks of heart disease, joint problems, and fatigue in seniors. Beyond the sugar and calories, dried fruits often contain additives like sulfur dioxide to preserve color and texture. While these additives are considered safe for the general public, they can cause issues for seniors with asthma, allergies, or sensitivities. Some people report headaches, skin rashes, or breathing difficulties after eating sulfur-treated dried fruits. Seniors with weaker immune or digestive systems may also find that these additives irritate their stomach, causing bloating or gas. Speaking of digestion, another big issue with dried fruits is their fiber content. While fiber is generally good for you, the kind of fiber in dried fruits can ferment quickly in the gut, especially when consumed in large amounts. This can lead to uncomfortable gas, cramping, and diarrhea. Prunes, for instance, are famous for helping with constipation, but too many can flip the problem and cause loose stools or urgent bowel movements. For seniors with sensitive digestion or bowel disorders like IBS, Dried fruits can easily trigger flare-ups. Even those trying to boost their fiber intake are better off sticking with whole fruits or vegetables, which deliver fiber along with water, vitamins, and fewer concentrated sugars. Another hidden problem with dried fruit is the way it interacts with dental health. Because it's sticky, it clings to the teeth much longer than fresh fruit. This gives cavity-causing bacteria more time to feed on the sugar left behind, increasing the risk of tooth decay and gum problems. Older adults are already more prone to dental issues due to aging gums, dry mouth from medications, and other factors, so adding sticky, sugary snacks to the mix only increases the risk. While dried fruits might sound healthy because they're still fruit, the reality is that they've been stripped of the water and balanced nutrients that make fresh fruit beneficial. They should be seen more like candy than a health food. If you do choose to eat dried fruit, keep it to a small portion and always read the label to check for added sugars or preservatives. But in most cases, it's safer and healthier to skip dried fruit altogether and enjoy whole, fresh options like berries, apples, or pears. These fruits offer natural sweetness, better hydration, and more balanced nutrition. The next time you reach for a snack, think about how your body will process it, not just how it tastes. For seniors focused on long-term wellness, dried fruits are best avoided or strictly limited. Lychee, a tropical fruit with a surprising toxic risk. Lychee may look like a harmless, exotic fruit with its rough pink skin and juicy white flesh, but for seniors, this tropical treat carries a hidden danger that most people have never heard about. Often found in fruit salads, canned in syrup, or served fresh in Asian cuisine, lychee contains natural toxins that can be especially dangerous when eaten on an empty stomach or in large amounts. One of the biggest concerns is a compound found in lychee called hyperglycin A, which is known to block the body's ability to make glucose. In simpler terms, this toxin interferes with the way your liver produces sugar to keep your blood glucose stable, especially during periods when you haven't eaten. For seniors, many of whom already deal with blood sugar regulation issues, insulin sensitivity, or medications for diabetes, this is a serious problem. Hyperglycin A can send blood sugar levels crashing down, leading to symptoms like confusion, weakness, tremors, fainting, and in severe cases, seizures or coma. This risk is especially high in undernourished or fasting individuals, which unfortunately includes many seniors who might skip meals due to loss of appetite, dental problems, or medication side effects. What makes this fruit even more dangerous is how subtle the symptoms can be at first. A person may simply feel tired, lightheaded, or unusually drowsy after eating lychee, and not realize it's connected to the fruit. In parts of India where lychee is grown, there have been documented outbreaks of unexplained illness in children who ate lychee on an empty stomach. Later research linked the illnesses to these same toxins, especially when no dinner had been eaten the night before. For seniors with slower metabolisms or weakened organs, the body is less able to clear these toxins quickly. This means even a moderate portion could create a problem. And it's not just fresh lychees. Canned lychees soaked in syrup may contain even higher concentrations of sugar, further disrupting blood sugar levels and overwhelming the body's natural systems. Another hidden issue is that lychees are often eaten in large quantities because they're small and sweet, almost like candy. 1 or 2 may be safe for a healthy adult, but it's easy to eat 5 or 10 without realizing the potential impact. And since lychees are usually served as a dessert or snack, they're often consumed on an empty stomach or after a light meal, increasing the chance that their toxins will have a stronger effect. Some studies have also found that unripened lychees contain higher amounts of these harmful compounds, and imported lychees may be picked before they are fully ripe to survive the trip to other countries. This creates a dangerous mix for seniors who buy imported fruit without realizing the added risk. On top of that, lychee is very high in natural sugar, about 29 grams per cup, which is more than most people realize. This sugar, combined with the fruit's potential to drop blood glucose levels afterward, creates a strange roller coaster effect in the body. First, a sugar spike that might cause jitteriness or headaches, followed by a rapid crash that leads to confusion or faintness. For seniors with any kind of cardiovascular condition, that drop in blood sugar can also trigger heart rhythm changes or a sudden drop in blood pressure. Even for those not on diabetic medication, the natural drop in glucose after eating lychees may leave them vulnerable to falls or accidents, especially if they're living alone or don't recognize the warning signs. And unlike more commonly known risky fruits like grapefruit, lychee warnings are almost never included in medical advice or nutrition labels, so it often goes under the radar. If you love tropical fruits, there are safer choices like papaya, mango in small portions, or kiwi, all of which provide vitamins and antioxidants without the dangerous compounds. The key is to understand that just because something is fruit doesn't make it safe for every person, especially as we age and our body's ability to handle toxins and sugar changes. For seniors, lychee is one of those surprising fruits that seems healthy on the surface but hides risks that can seriously affect blood sugar, energy levels, and overall health. It's better to avoid this fruit altogether or only consume it occasionally, with food, and in very small amounts under guidance. When it comes to managing health in your later years, knowledge is just as important as nutrition. And the more we know about how our favorite fruits affect our bodies, the better choices we can make to stay strong, safe, and energized. Bananas, the potassium problem no one talks about. Bananas are often thought of as one of the healthiest fruits around. They're easy to eat, inexpensive, and full of potassium, which is a key mineral that helps support heart health, nerve function, and muscle strength. But for seniors, especially those with kidney issues, high blood pressure, or those taking certain medications, bananas can be more harmful than helpful. That's because bananas contain a high amount of potassium, about 422 milligrams per medium-sized banana. While potassium is essential, too much of it in the bloodstream can lead to a condition called hyperkalemia, which can cause serious problems like muscle weakness, irregular heartbeat, and even heart failure. The kidneys are responsible for keeping potassium levels balanced, but as we age, kidney function often declines, even in people who aren't diagnosed with kidney disease. This makes it harder for older adults to get rid of excess potassium, and when they eat potassium-rich foods like bananas every day, the levels can build up over time without them knowing. Many seniors also take medications that affect potassium levels. Common blood pressure drugs like ACE inhibitors, ARBs, and potassium-sparing diuretics can all raise potassium in the body. If a senior is on any of these and eats a banana daily, they may unknowingly be pushing their potassium to dangerous levels. Unfortunately, the symptoms of high potassium are often subtle at first. Fatigue, tingling in the hands or feet, or nausea may not be immediately linked to the fruit in your breakfast. But over time, the build-up can become serious. According to the National Kidney Foundation, people with reduced kidney function need to limit foods that are very high in potassium, and bananas top that list. Even a single banana can be too much if potassium levels are already elevated or if kidney function is compromised. This is particularly dangerous for seniors because lab tests to monitor potassium are not always done regularly, and symptoms can be mistaken for other age-related issues. Another problem with bananas is how fast they release sugar into the bloodstream. Even though they contain fiber, ripe bananas have a high glycemic index, especially when fully yellow or spotted. This means they can cause blood sugar spikes, which is not ideal for older adults with diabetes or those managing their glucose levels. The riper the banana, the higher the sugar impact. Overripe bananas are particularly popular in smoothies and baked goods, but they have a higher sugar load and a lower fiber benefit than less ripe ones. Seniors who are told to eat bananas for energy or muscle cramps may not be getting the full picture. While the magnesium and potassium in bananas can help with cramps, the sugar and potassium load can outweigh the benefits if consumed daily, especially without balancing other parts of the diet. There's also a common misconception that bananas are good for digestion because they're bland and soft. While they may be easy to chew, they're not always the best for gut health in older adults. Unripe bananas can cause constipation due to resistant starch, while ripe bananas may worsen diarrhea for those with sensitive stomachs. For seniors dealing with common digestive issues like constipation, irritable bowel syndrome, or slow digestion, bananas can either help or hurt, depending on the individual. It's not a one-size-fits-all food. Too often, doctors or caregivers recommend bananas without considering the person's full medical picture. That's why it's so important to look at the whole story. Instead of eating bananas every day, seniors can consider switching to fruits that are lower in potassium and sugar, but still rich in nutrients. Apples, blueberries, and peaches are good examples. These fruits offer antioxidants and fiber without overwhelming the kidneys or blood sugar levels. For those who truly enjoy bananas, moderation is key. Half a banana a few times a week may be okay for some, but it should always be balanced with your overall potassium intake and discussed with a doctor if you're on any medication that affects your electrolytes. In the end, the message is simple. Bananas are not bad, but they're not always good for every senior. Knowing your body, your medications, and how food interacts with both is the best way to stay safe. It's easy to think that something as common as a banana must be harmless, but for many older adults, that assumption could be putting their heart and kidneys at risk. Better alternatives, safer, nutrient-rich fruit seniors can enjoy daily. Now that we've talked about the fruits seniors should avoid, let's focus on what they can enjoy safely and regularly. The good news is that there are plenty of fruits that are not only safe for older adults but also packed with the nutrients they need to support healthy aging. These alternatives are lower in sugar, gentler on digestion, and don't interfere with common medications or medical conditions. First on the list is blueberries. These small, dark berries are rich in antioxidants, especially a type called anthocyanins, which help protect the brain and reduce inflammation. Multiple studies have shown that blueberries can help improve memory and cognitive function in older adults. They're also low in sugar and have a low glycemic index, which makes them a smart choice for anyone managing blood sugar. Just a handful a day can provide noticeable benefits without the risk of sugar spikes or digestion problems. Plus, they're soft and easy to chew, making them ideal for seniors with dental issues. Another great fruit for seniors is apples, especially when eaten with the skin. Apples are high in fiber, which supports digestion and helps regulate cholesterol levels. The type of fiber found in apples, known as pectin, also feeds the good bacteria in the gut, which becomes more important as we age and our gut microbiome naturally weakens. Apples also contain vitamin C and potassium, but in more balanced amounts than bananas or citrus fruits. Because they come in so many varieties, they're easy to include in your diet without getting bored. Seniors can slice them, cook them with cinnamon for a soft treat, or pair them with a little nut butter for a balanced snack. Just remember to choose organic or wash them well to avoid pesticide residues, since apples often rank high in pesticide exposure. Pears are another gentle, digestion-friendly fruit. They're rich in fiber and water, helping with constipation, which is a common issue for many older adults. Pears are also low in acid, so they're less likely to cause heartburn or stomach upset, which makes them a good choice for seniors with reflux or sensitive stomachs. Their soft texture is another plus for those with chewing or swallowing concerns. When ripe, they're naturally sweet but have a low glycemic impact, which means they release sugar more slowly into the bloodstream. This makes them a better everyday option than tropical fruits or dried fruits. Next on the list is kiwi, a fruit that's often overlooked but packed with benefits. Kiwi is full of vitamin C, more than an orange, and also contains fiber and natural enzymes that support digestion. It has a mild taste, a soft texture, and helps the body absorb iron better, which can be especially important for older adults who are at risk of anemia. Kiwi has also been shown in studies to help improve sleep quality, which is another common struggle for seniors. It's easy to slice and eat with a spoon or blend into a smoothie for an energizing start to the day. One kiwi a day can make a big difference in both digestive health and immune support. Finally, let's talk about papaya. This tropical fruit is one of the safest for seniors, despite its exotic appearance. It's rich in vitamin C, folate, and an enzyme called papain that helps break down protein and ease digestion. It's especially helpful for seniors who struggle with slow digestion or bloating. Papaya is also soft, easy to chew, and low in sugar compared to fruits like pineapple or mango. Just a small portion can offer big benefits, especially when eaten on an empty stomach in the morning. Papaya also supports skin health and joint function due to its anti-inflammatory properties. Choosing the right fruits isn't just about avoiding harm, it's about supporting the body in a way that feels good and promotes energy, digestion, and long-term health. By focusing on fruits like blueberries, apples, pears, kiwi, and papaya, seniors can still enjoy natural sweetness and variety without the hidden dangers found in some of the more problematic fruits. It's also helpful to keep portion sizes in mind and to pair fruit with a source of protein or healthy fat, like a small handful of nuts or a bit of yogurt. This helps slow sugar absorption and keeps energy steady throughout the day. When in doubt, fresh is best. Canned fruits often contain added sugars and preservatives, while dried fruits are concentrated in sugars and harder to digest. Frozen fruit is also a good option, as long as it doesn't have added sugar. The key is to treat fruit like a powerful tool, not just a treat. When chosen wisely, it can support brain health, digestive balance, heart function, and even bone strength. Seniors don't need to fear fruit, but they do need to be mindful of how different kinds affect their unique bodies. With the right knowledge, fruit becomes more than food, it becomes a daily dose of wellness. By making smart swaps and choosing nutrient-rich, low-risk fruits, seniors can keep enjoying nature's sweetness without compromising their health.